Hi, welcome to another episode of Richard Harris's Herbal Tutorials. I'm Richard Harris. This video is the B part of episode 13, in which I discussed female infertility and how it's viewed in traditional Chinese medicine. In this episode, I shall continue from where I left off. For those who missed part 1, please check my other YouTube videos and look for episode number 13. Just to recap, in episode 13, I mentioned 3 types of syndromes that are regularly encountered in female infertility. In this episode, I shall discuss a few others. Starting after syndrome 3 is syndrome 4, called cold dampness retention syndrome. According to this syndrome, the patient manifests symptoms of delayed menstruation, cold abdomen, cold extremities, dysmenorrhea, which responds to warmth, dark menstrual flow, leukorrhea with thin white discharge. The principle of treatment is to warm the meridians, expel cold, and invigorate blood flow. Western trained physicians may diagnose this syndrome as dysmenorrhea, fibroids, amenorrhea, and endometriosis. Syndrome 5, kidney and liver deficiency syndrome. The symptoms manifesting because of this disorder is lower back pain, tiredness, lower abdominal soreness, little desire for sexual intercourse, weakness of the lower limbs. In TCM, the kidneys rule the reproductive organ. The kidneys also live in the back, so its influence is felt in the lower back and in the lower abdomen. The liver also demonstrates its influence over the reproductive organs because of its connection with those organs via the liver meridian, which circles those organs. This condition is a condition of deficiency or weakness. The principle of treatment is to strengthen the liver and kidneys. A 6th pattern is known as deficiency of the spleen qi and the kidney qi, which basically means a deficiency of the energy of both of these organs. This syndrome displays symptoms of tiredness, lack of appetite, a heavy bearing down sensation in the abdomen, loose stools, lower back pain, frequent urination. Why this syndrome is linked to the kidney and the spleen? As mentioned before, the kidneys rule the reproductive organs and reside in the back. The spleen makes energy and blood, keeps the blood and organs in their proper place, and it rules digestion. Hence the tiredness, no appetite, soft stools, etc. The spleen and kidney qi is therefore considered a deficient condition, one of weakness. Western medical experts may consider this as a prolapse of the uterus, enuresis, irritable bowel syndrome. The principle of treatment is to warm and tonify the spleen and the kidneys. Another syndrome is deficiency of qi and blood. The symptoms seen with this issue are tiredness, brittle nails, amenorrhea, pale face, dry mouth, pale tongue, a tendency to feel cold easily, dry skin, scanty menstruation, falling hair. This is also a syndrome of deficiency. Western physicians may diagnose anemia, enuresis, prolapsed uterus, amenorrhea, etc. The principles of treatment is to nourish the blood and strengthen the spleen. Note the first 4 patterns discussed, starting with number 1, 2, and 3 in episode number 13, and continue with pattern 4 in this episode, are all termed excessive conditions, and the method of treatment is to use attacking medication to remove the pathogens. The last 3 issues are termed deficiency syndromes. Tonics or supportive medications are given. The medication that should be given in the first 4 instances, called excessive syndromes, are generally not used in the latter cases, because they being attacking medication, may further deplete the patient's vital substance and energy. On the other hand, the medication used in the last three patterns, termed deficiency patterns, are generally not given to the first four patterns. Very soon, the herbs used to treat all the different patterns discussed will be uploaded under their respective classification. For example, herbs for stagnant blood, herbs for moving chi, herbs for replenishing blood and chi, herbs for moving dampness, etc. I'm sure by now you're seeing principles involved, construct, common sense, etc. Gets one to thinking, isn't that so? That's all for now. Sorry, but all good things must come to an end. See you soon with more interesting videos. If you enjoyed this video and you learned something useful, please like, comment, and subscribe. And by the way, please remember to share it. Others may benefit as well. Bye.